Good afternoon, Dr. Chamberlain. My name is Michael Francescone, and the new emerging technology tool that I chose to present with the potential to improve a leader's access to timely, accurate public health information is MyChart, a user-friendly, secure website where you may obtain your health information. What is MyChart? MyChart allows patients to view parts of their health information online securely and independently. It enables you to securely access the internet to manage and get information concerning your health. Access your health summary from the MyChart electronic health record through MyChart on the internet. Now let's take a moment to think about how you use technology each day. When we think about how we use technology each day, you read the news, get in touch with family and friends, make reservations, and even order groceries. Did you know you can use the new emerging technology MyChart on your phone, tablet, or PC to stay connected to your healthcare or up-to-date public health information? For example, let's say you have a symptom. Maybe it's not the best idea to search the internet because misinformation can lead to internal and external panic. Instead, with MyChart, you can send a secure message to your care team or healthcare providers by messaging or sending a photo. You'll get reliable advice and next steps. If you need an appointment, schedule from wherever you are with or without a phone call. If an earlier time becomes available, you'll be alerted so you can be seen more quickly. And even check in ahead of time to avoid waiting in line at the clinic. If getting to the clinic is impossible and you don't need to be seen in person, you can request a video visit. Let's dive into the clinical side of MyChart. MyChart is such a great tool that with MyChart, your clinical information is always available, from visit information to lab results to a list of your ongoing care needs, immunizations, medications, and more. If medication is running low, there's no need to call the pharmacy or doctor's office. Simply request a refill via MyChart. Plus, MyChart syncs with your fitness device to update your medical record with your daily health habits and activity. If the need arises, release your health data to any provider with internet access, no matter where you are. And let's not forget about your family. Whether you're in charge of rambunctious children or helping an aging parent, review and manage their care and yours, all from a single portal. And through one MyChart account, you can even see health information from other places where you and your family receive care. Always remember that MyChart is your secure online health connection. So let's move over to my infographic poster and let's take a look at how you can use MyChart. So according to Bula, you can look at your test results, access your test results easily. The majority of test results may be obtained through MyChart with certain limitations for some sensitive test findings. You can schedule appointments. You may save time by using online scheduling or simple e-check-in. You can message your physician or provider, send a direct message to your doctor or other providers with any queries or worries, and you can request refills. You can review a list of your current medications, ask for refills, and learn about your medications by accessing the About This Medication section within MyChart. Now let's take a look at how MyChart can make it easier for leaders to gain reliable, up-to-date public health information. So MyChart can make it easier for leaders to gain reliable, up-to-date public health information through patient and healthcare provider communication, provides leaders with social and economic factors that drive health outcomes such as economic stability, neighborhood and physical environment, education, community and social context, and healthcare system. When healthcare providers have access to a complete picture of a patient's health history, they can offer a thorough treatment plan, which allows data to be shared between doctors, researchers, and leaders, which help public health organizations increase in development. Let's look at another reason why MyChart makes it easier for leaders to gain reliable, up-to-date public health information. MyChart provides leaders access to electronic health records, health information exchanges, vital records, immunization information systems, and early alert for health events by tracking symptoms such as respiratory distress, fever, and vomiting before a diagnosis is confirmed. which in turn provides leaders with critical important data about a specific population's health needs and effective interventions to practitioners and leaders responsible for addressing public health and patient care. Now let's take a look at my infographic poster and look at some of MyChart's benefits and challenges. Like any new or emerging technology tool, there are always benefits and challenges. The benefits of MyChart are scheduling medical appointments, viewing a health summary, viewing test results, renewing prescription, access trusted health information resources, communicating electronically or virtually with your medical team, sending pictures or messages about health concerns, and access to up-to-date information. Some of the challenges that we face with MyChart are the struggle with technology, pre-check-in struggle, slow communication form for private messaging, having to create multiple accounts, one-person provider, and not being able to use the application outside of the United States. Now let's talk about a scenario in which MyChart can help lead a public health organization through a challenge. The scenario. Being a part of the patient-centered medical home model, our 5 key functions were comprehensive care, patient-centered care, coordinated care, accessible services, quality, and safety. The challenge. To assess whether adoption of the patient-centered medical home reduces emergency department utilization among patients with or without chronic illness. By following the PCMH guidelines and standards, our public health organization put MyChart to the test to see if it would help reduce emergency room utilization. It took about 6 months to a year to ensure MyChart hit all the marks for what the PCMH mission stands for. Now let's talk about how MyChart played a major role in the scenario. The development of MyChart into our public health organization played a significant role in the scenario. The virtual ED room was our jackpot in the implementation process of MyChart because it allowed for our population of patients through education to understand when to utilize the emergency room and when not to utilize the emergency room, which eventually reduced the percentage of patients utilizing the emergency room. The residents at our clinic would rotate on a weekly basis to be a part of the virtual emergency room through MyChart and meet with patients who were concerned about their health issues. If the ED needed to be utilized, our residents would refer the client to the emergency room and have an ambulance pick up the client if unavailable to be taken by a family or friend. Now, I know what you want to know is how were we able to get our patients to actually utilize MyChart's virtual emergency room? Let's discuss this in the next section. Before moving into how we were able to fully educate our patients in utilizing MyChart and our virtual emergency room, let's move over to my infographic poster. And let's keep in mind that connected care helps keep patients out of the emergency room. So according to Kate 2023, Ochsner Health provided patients receiving chemotherapy with connected devices and MyChart Care Companion. This empowers them to self-monitor vital signs and symptoms and keep their care team in the loop about concerning results. The program reduced ED visits and admissions by 33%, decreasing the cost of care by over $1.2 million for currently enrolled patients. So as you can see, utilizing MyChart effectively and educating your patients to utilize it and the benefits will eventually reduce the amount of patients going into the emergency room for unnecessary circumstances. Now let's get back into how we were able to ensure our patients were active, educated MyChart users. As we all know, patient education is important when implementing a tool that would be utilized by patients within a public health organization. We ensured that our intake and discharge nurses would educate our patients on how to use MyChart and explaining the benefits of using MyChart. Our public health organization hired volunteers, which we called MyChart experts. They would walk around during primary care office hours, ensuring patients had an active MyChart account, and if not, assisted in creating an account for them. These experts were there to educate and assist for about over a year or so to ensure that patient population took full advantage of MyChart. Within 6 months to a year, there was a dramatic shift from scheduling appointments via office to scheduling through MyChart. Many of our clients requested refills through MyChart instead of calling our office to request these refills from our physicians. Between January of 2018, when MyChart was launched, to January 2019, our primary care practice saw a 10% decrease in ED utilization, which was well above average. This goes to show many public health organizations that patient education is a vital component to seeing a change in data within a public health organization. So let's check out my infographic poster and let's check out some evidence. So what we want to know is if patients really do log on to MyChart and that they do schedule appointments with their primary care physician, that they're checking out their test results, and that they're actually utilizing this application. So according to Riddlemeyer, 32,325 patients were found to have signed up for a MyChart account throughout the research period. Page views mirrored logins totaled approximately 3,029 on average each day and amounted to roughly 5 on a typical login. So this evidence goes to show you that patients do utilize this application because they find it useful that they can actually get in touch with their primary care physician through this portal, and that they're able to schedule an appointment without having to wait on the phone to speak with a secretary in regards to scheduling. So as we can see, MyChart is extremely beneficial in the public health organization. Now let's take a look at the types of exchanges prior to implementing MyChart. Before you begin designing your integration, you must first understand what data you plan to exchange with MyChart. We started by defining the discrete types of data that our MyChart app will work with and define a scope for the level of detail required within the data set. For example, you need to exchange medication information. You should then more specifically define data elements you need within the data type, such as dosage information, prescription codes, etc. Now let's move into the direction of data exchange. Direction of data exchange. After you have defined the data, you need to exchange and determine the direction of that exchange. For example, an integration that transfers data from MyChart to clinical registries may only need to read data from MyChart. Meanwhile, an integration that results lab orders will need to write data back to MyChart. Make sure you understand which data types need to be read out of MyChart and which need to be written into MyChart. Now, let's look at workflows using data exchange. Workflows using data exchange. Next, determine when and how this data exchange should occur. Does data exchange occur based on a specific event, such as a clinician placing an order or a patient being discharged? Does data exchange occur on a schedule, such as a nightly data extract? Does data exchange occur when a user decides to launch your application? Some methods of data exchange might only be applicable in a specific workflow or when specific events occur. Before determining your appropriate data exchange method, you must first define the workflows in which you plan to exchange data with MyChart. Now let's take a look at the data exchange method. Data exchange method. MyChart recommends using industry standards for data exchange whenever possible. The most appropriate standards for your use case may vary. For example, NCPDP standards may be the most appropriate method to exchange of pharmaceutical data, while digital imaging and communication standards may be the most appropriate method to exchange medical images. Once a data set, direction of data exchange, and workflows in which that exchange should occur are defined, you need to determine which standards or specific technologies are the most applicable. Now let's take a look at security mechanism. Security mechanisms. Due to the sensitive nature of healthcare data, data exchange technologies generally require various forms of authentication, authorization, and security. Some integrations may use an SSO solution such as a smart, on FHIR for authentication, while others rely on security mechanisms like client certificates or TCP/IP connections. Consider what authentication mechanisms are supported by the data exchange methods you have selected, such as MyChart. Now let's reflect on what I have learned in this course about leadership and management in a public health organization. Reflecting on what I have learned in the course about leadership and management in a public health organization. So one of the things that I've learned throughout the course about leadership and management is that they both play a vital role within a public health organization. Management is the process of coordinating people and other resources to achieve the goals of an organization. Managers coordinate an organization's resources to achieve the organization's goals. When we look at leadership, leadership is the process by which a person influences others to accomplish an objective and directs the organization in a way in which makes it more cohesive and coherent. Leadership is the art of motivating a group of people to act towards achieving a common goal. At the end of the day, both managers and leaders are similar, but they also are very different. So when we look at a manager, they're more present-focused. They're short-term oriented. They prefer to be in control. They experience complexity and worked within an organization and business. When we look at leaders, they're more future-focused, long-term oriented, vision engaged, believes intuition, and considers social and environmental contexts. Let's recap on how leadership and management apply to the benefits and challenges to MyChart and the scenario given earlier. Leadership and management both play a role in the implementation of MyChart and reducing the emergency room visits along with the PCMH guidelines and the emerging tool of MyChart. Leadership and management both apply to the benefits and challenges because effective management and leadership during an implementation like a patient portal are vital during these times of complexity in an organization that is evolving in technological tools to advance patient and organizational change. As we have noted in this presentation, MyChart has reportedly decreased the cost of care by over $1.2 million, which saves the public health organization money to potentially execute other critical needs for staff and patient care. The team's leader's duties for an organization include managing the group and assisting it in achieving its objectives. The ability of a manager to effectively lead their team may be threatened by obstacles, but leaders can improve during challenges by understanding how various obstacles impact leadership. With an understanding, they are able to increase growth and profitability, including patient care. In conclusion, MyChart is the emerging technology tool with a potential to improve a leader's access to timely, accurate public health information. The best part about this emerging tool is that it is a free service offered to patients. Thank you so much for listening to this presentation. Please see the next slide for a review of references.